Antimicrobial prophylaxis. Clinical scenario. Prevention of post-surgical infection due to Staphylococcus aureus. Recommended medication. Cefazolin. Use vancomycin instead if the patient is at risk for MRSA, example history of MRSA colonization or in high-prevalence hospitals. Question 1. A 67-year-old man is scheduled for elective hip replacement surgery. He has no known drug allergies or history of MRSA colonization. What is the best antibiotic to prevent surgical site infection? A. Vancomycin. B. Ceftriaxone. C. Cefazolin. D. Amoxicillin. E. Metronidazole. Correct answer, C. Cefazolin. Explanation. Cefazolin is the first-line antibiotic for surgical site infection prophylaxis, especially for skin flora like Staphylococcus aureus and Streptococcus species. It is effective, has a long half-life, and penetrates tissues well. Why not the others? A. Vancomycin, used only if the patient is at risk for MRSA. B. Ceftriaxone, not the drug of choice for skin flora or surgical prophylaxis. D. Amoxicillin, does not provide adequate coverage for Staph aureus. E. Metronidazole, used for anaerobic infections, not for typical skin flora. Question 2. A 52-year-old man is undergoing cardiac valve replacement surgery. He has a history of MRSA colonization. What is the best antibiotic to prevent surgical site infection? A. Amoxicillin clavulanate. B. Vancomycin. C. Cefazolin. D. Clindamycin. E. Azithromycin. Correct answer, B. Vancomycin. Explanation. Vancomycin is used for prophylaxis in patients with a history of MRSA or in settings with high MRSA prevalence. It covers methicillin-resistant Staph aureus and is effective in preventing serious postoperative infections. Why not the others? A. Amoxicillin clavulanate, not standard for surgical prophylaxis, lacks MRSA coverage. C. Cefazolin, not effective against MRSA. D. Clindamycin, can be used in penicillin-allergic patients but is not first line for MRSA in this setting. E. Azithromycin, used for atypical respiratory bacteria, not skin, or MRSA.